I'm John Migaly. I'm a colon and rectal surgeon. I'm the chief of colon and rectal surgery for Johns Hopkins Medicine. Essentially what that means is I have oversight of the faculty, education, research, and care of patients with diseases of the colon and rectum across all the environments of the Hopkins system, including the National Capital Region, Sibley and suburban hospitals, Bayview, Howard County, and of course, Johns Hopkins Hospital on main campus. My specific clinical interests are rectal and colon cancer and inflammatory bowel diseases. With regards to colon and rectal cancer, I'm very interested in the contemporary care of cancer patients, including organ preservation, minimally invasive surgery, including robotics, multidisciplinary care, and shared decision-making. I'm very interested in the recent epidemic of colorectal cancer in young patients, and what I want to provide patients is wraparound care, providing them access to counseling, emotional, financial, access to reproductive services such as gynecology and urology. I want to make sure that they have access to the cutting edge trials and access to geneticists for not only them, but for their families. I think my philosophy of care has a lot to do with how we meet the patient. When we meet the patient for the first time, I think we can't underestimate how vulnerable sometimes patients feel when they're interacting with a proceduralist. And I think there's a false assumption that that care will be episodic and self-limited, and I think that that's not how I want to approach my patients. I want them to understand that that I do feel what they're feeling. I understand that they are at a crossroads and there's a lot of decisions to be made, and they're interacting with so many people, and retention of data is so difficult, and I understand all of that. So I want them to see me more as the quarterback and somebody who puts a team together around him to get the patient from where they are and then past the goal line. So really it's about creating that confidence in the patient that there is somebody who's going to guide them through all aspects of the care, not just this operative episode, who will put the good team together, who will get them to the right counselors, to the right subspecialists that will enhance their care, and that will actually expedite a little bit for them and help them in terms of navigating a very difficult system. If a patient asks me why they would choose Hopkins or why they should choose Hopkins, I would answer it's really the same reasons I chose Hopkins. My entire career has been spent in academia, and I've been at several institutions. What I see that's different about Hopkins is how they really take care of things at a superior level, at the micro and the macro level. There are very vulnerable populations, at-risk populations in Baltimore and in Maryland that need our care, and we have the world's experts here. We have clinical trials and that are bar none, and I can pick up a phone and talk to an expert, a luminary in their field at any point with any question I have, and that's what we give the individual people in Baltimore and Maryland. But on a larger scale, we take care of people from 6 hours away who get on planes from the other side of the country. We take care of patients on an international level, and we're able to scale up our efforts and use the power of our infrastructure and our expertise for people in other countries or people in our backyards. And I think that I have not seen anything like this, and I believe that this should be something that's in the back of every patient's mind. That, how does this institution adapt to me in particular, and how can they use their resources for me in particular?